One of the junior nurses said to me, I used to have a pocket full of papers, and I used to have to, before the end of my shift, I'd look at all my bits of paper to make sure I've done everything. Now with the Federated Data Platform, it's all in the system, so she doesn't have to worry about it. And she says it makes a difference, because she would quite often go home, sit in the car park and think, oh gosh, I've forgotten about Mrs. or whatever, and she'd run back in or she'd phone somebody. That again shows you the level of care that our staff have for their patients.
A lot of clinicians in their day-to-day roles, when you speak to them, they're logging into 7-8 different systems just to complete one patient transfer.
Spreadsheets, bits of paper, email trails, the logistics of care, that's how I think about it, has many steps and many handovers. There are a number of logistics activities that need to happen and come together in order for you to be released from the hospital.
You've got all this data all in different shapes, and we want to bring it together so that you can see everything in one view.
That basically means we're connecting and liberating data from siloed systems into a single repository. Now, the opportunity on the back of that is phenomenal.
So the NHS Federated Data Platform is software that enables us to connect together lots of our local organisational system, your theatre management system, your workforce system, your patient system. It allows us to connect all those together so that we can use that information in operational workflow.
What we designed in the FDP was we created segregated instances which every NHS organisation owns for themselves, but underpinned by what we refer to as the canonical data model, the CDM. The CDM is consistent across every instance that we deploy. Data shouldn't have to leave a sovereign organisation. It can be called and queried upon need, rather than it needs to move every single time. Foundry, as a tool that underpins the Federated Data Platform, provides this unique capability of purpose-based access controls. So the data that you have is only for the use that it's already been permitted for. This is, from my perspective, is pretty unique to the Foundry tool. And I've been absolutely blown away by this capability.
So we spend a lot of time on site meeting with real operational teams, frontline clinicians, and trying to experience those problems firsthand.
Working with Palantir is fantastic because you've got very young, dedicated, kind of guys that just want to get on with doing things, but they're very happy to have a go and iterate.
Largely for me, Palantir has been really good in that they've kind of given me a lot of responsibility and a lot of autonomy and put me on a problem that actually I care quite a lot about.
It's been fantastic working with Palantir as a partner. We're at the table together, working with our local organisations, thinking about innovative solutions to the biggest challenges that the NHS is facing today, and the tenacity, the skills that the Palantir engineers bring is phenomenal.
We were able to build the first theatre scheduling product in a matter of weeks. From ideation to and concept to product was done, I think, in about 3 weeks. And we were testing it with one clinician at the hospital and a theatre manager. It was demonstrating activities which previously took over 4 minutes to do, to be done in 30 seconds.
We were able to look at individual cases of patients who had had appointments cancelled at one trust and they've been transferred over to another trust and were able to be seen sooner. And I think on average, people were being seen about 40 days sooner, some up to 2-3 months sooner, which is incredible. And this is people just going 20 minutes down the road to a different hospital who has more capacity.
Every hospital that uses our inpatient product generally sees over 120 extra procedures per month per trust that uses it. We've already delivered over 80,000 extra procedures since the rollout of FDP. That's 80,000 extra patients being seen in existing NHS capacity.
What's been brilliant is hearing the feedback from our local organisations. So we have maybe an anaesthetist in a hospital that's saying it's normally really difficult for me to understand what my schedule looks like, and actually with FTP I can log in myself, I know my patient list, And game-changing is one of the phrases that I hear the most. One of our matrons said, "You've changed my life. It's just so much easier. I can log into one system, I can access the information I need, and I can discharge my patients on time."
People like me do this job for a reason, right? It's for public value, and sometimes you come across things that really melts your heart, right? Really gets to you. The consultant, cancer consultant that we were working on the cancer waiting list tool, what she said to me was, since using the Federated Data Platform, she's been able to space her day out in a way that means that she can spread good news amongst the bad news that she has to give to patients. So now that seems quite a small thing, but if you're giving bad news all the time, it really means a lot.
And so, like, to me, the FDP provides like an opportunity for us to actually systematically solve some of those bigger problems in a way that isn't just like limited to a trust, but is actually kind of like scalable and will actually make a larger difference across the whole NHS.
The skills that the Palantir engineers bring to the NHS FTP programme are phenomenal. Their technical capabilities, their engineering capabilities, their business acumen, and their ability to work with our local organisations and really understand what those challenges are is fantastic. And that means that when we're presented with the biggest challenges that the NHS faces today, having a Palantir engineer working side by side with us in partnership means that we know that we'll come up with a solution that means that we can deliver better patient outcomes and services.
So we have a lot of staff that burn out because of the extraordinary tasks that they have to do and the amount of bureaucracy in the system. So being able to help deliver a tool like the Federated Data Platform is immensely helpful. And for me, that's kind of worth all its weight in gold.